According to the CDC, 20 to 25% of American adults are in mental health treatment. And according to the National Institute of Mental Health, that was as high as 50% in 2022. Yet there's still so many people who do not seek mental health treatment due to the stigma behind the illness or for various reasons. So this video is going to explore a little bit about some of the stigma in mental health, whether it's the stigma that one feels on themselves, maybe the stigma that society puts on them, or sometimes it's even certain career paths that may put stigma around those who are suffering from mental illness. Now, typically women are more likely to be in mental health treatment than men. A lot of times it's just men need the mental health treatment, but they don't get the treatment. In fact, men are more likely to commit suicide than women. So really, a lot of times men need mental health treatment, but are not in it. So what are some reasons that people may be resistant to mental health treatment? Well, maybe they're feeling weak, or maybe they're feeling it's all in their head, or that they just need to change their life or work harder and they'll just snap out of it. That might be true in some cases, but in many times, some people may suffer from mental illness due to no fault on their own. Perhaps they've been abused in their life. Maybe they have a family history of anxiety or depression, so they're more likely to get anxiety or depression. Maybe they're having a medical condition such as anemia, which can lead to anxiety, or maybe thyroid problems. For example, low thyroid can lead to depression. High thyroid can lead to anxiety. So there are so many reasons someone may be suffering from a mental illness and need treatment, and don't let the stigma prevent you from getting the treatment. Sometimes people just don't want to be labeled or judged. For example, when people are suffering from depression, sometimes there are medications that are prescribed for schizophrenia, like antipsychotic medications, that can also help with depression. Although, because they are labeled as antipsychotic medications, some people will not take those types of medications just so they're not labeled as a psychotic or crazy person. So those are some self-stigma reasons that people may going through. What about the public stigma? Well, I'm sure we've come across into these stereotypes of people who maybe think that people with mental illness are dangerous or incompetent. And so they may be excluded in certain societal situations, like in certain healthcare facilities or the workplace. Oftentimes, just if people have a diagnosis of a personality disorder or sort of substance abuse, it can lead to people coming across and judging them for these labels that they may carry. People really need to be cognizant of their own biases that they may hold so that they don't jump to these conclusions of people who suffering from mental illness or of these labels that people have. Sometimes they're just systematic procedures that are in place that may have some sort of biases or may have some sort of stigma with mental illness. For example, to get a license for a medical license, oftentimes the governing bodies will ask if the person is suffering from a mental illness. Or when you ask for evaluation from one of their colleagues, they'll ask, is this person suffering from something that is going to impact their ability to work? And so yes, it's important that someone has a clear mind and able to work, but it can lead to too much biases and have people afraid to admit that they're suffering from a problem, because it may put their career in jeopardy. And this is not only true with physicians, but this is also true in nursing and other healthcare fields. So you can see that not only can there be an added pressure or challenge when suffering from mental illness, but also there can be an added pressure or challenge from those around us for going through this illness or for suffering. Now imagine a conservative community where you're required to follow more religious or moral norms. Mental illness can be viewed as some sort of divine punishment or failing in moral principles, and this can intensify the reluctance for someone to seek treatment. And in one of the Old Testament books, the Wisdom of Sirach, which is a deuterocanonical book, talks about the purpose of medications and says that the Most High God has created medicines from the earth, and a prudent man will not abhor them. So basically the scripture is saying that medicines are from God, and it's supposed to be used to help mankind, to help people, to help God's creation. And we do have medicines for so many mental health conditions, whether it's anxiety, depression, anger, mood problems, sleep problems. And these are there to try to help people and alleviate them from their suffering. The text further states that The benefits of these things is recognized by men, and the Most High has given this knowledge to men, so that he may be honored in his wonders. By these things he will cure or mitigate their suffering, and the pharmacist will make soothing ointments, and he will form healing medicines. So again, God gives people the ability to make these medicines and the ability to take these medications to help them with their sufferings. But the scripture does provide a warning, and I think this warning could be a way that the devil really misconstrues, so that it can create a further stigma behind receiving mental health treatment. And the warning says that he who sins in the sight of the one who made him will fall into the hands of the physician. So the Bible itself does state that sin can result in some sort of suffering in the form of mental illness, and that can cause someone to need medications to get better. So I can definitely see how society can jump to this conclusion that because someone is in mental health treatment, it's because of some sort of sin or moral failing on their behalf. But as I mentioned earlier, that may or may not be the case. Perhaps it's due to a medical condition or genetic factors, or maybe just some sort of factors that the person has no control over on their own about. So there are many reasons why someone may be in mental health treatment or may need mental health treatment. There should be no guilt or shame about receiving treatment. Even if it is due to some sort of moral failing or sin in one's life, God is forgiving and loving, and he does not hold on to remembrance of those sins if someone really changes their ways and aims to do good and do better. And likewise, us as a society should not put added shame or burden on people that are trying to get better and receive help for whatever they're dealing with or their sufferings.